Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Wednesday, July 15th, 2020. Joining us today, Mayor John Tory and Toronto's Medical Officer of Health, Dr. Eileen de Villa. Mayor Tory?
Brad, thank you and good afternoon. Over the past few weeks, as people know, we've been working very hard, all of us, with a great city team to reopen the city and the many services and amenities that the residents of the city enjoy. We remain in Stage 2, of course, for a while longer, but we have seen in Stage 2 the reopening of the city's libraries, in part, outdoor swimming pools, splash pads, community gardens, and many more things, including this week the Riverdale Farm, the High Park Zoo, Allen Gardens, and the Centennial Park Conservatory, which all opened up this week. We are continuously working to ensure that these amenities and services are ready to reopen as quickly as possible, but with a huge focus on safety and health to make sure that when they reopen safely and in a way that is consistent with public health. We need to do this in anticipation of the next stage of reopening, Stage 3, so that we are ready for a new round of services and amenities that can open up under the provincial orders that will prevail when we reach Stage 3. I know that our staff are committed to the swift opening of things like playgrounds and the expansion of activities for team sports and other forms of instructional recreation once that announcement comes. But we do continue to make progress, and I'm very pleased to announce today that our city's community centres, including indoor pools, will be reopening next Monday, this coming Monday, July the 20th. That means a total of 119 community centres right across the city will reopen, including 29 which feature indoor pools. Community centres play a vital role in the communities that they serve, and each time we've had to make use of them or close them for some purpose or other, including the pandemic, we can see that people miss them. They miss them greatly, kids and families and seniors and just about everybody else do. They provide a safe space for many, a place to socialize and connect, and where you really see a sense of community across our city, a place where healthy activities help to build strong communities and support people in many different ways. Community centres have become a place for everyone, whether it is children or youth or seniors or families. Everybody can find a way to connect in one way or another in our community centres. Now, the unfortunate closing of these centres during the height of the pandemic impacted the lives of many people in our city. I know that people are eagerly waiting for them to open back up so they can have a place to go and, more importantly, a place that they can rely on. As with all things that we've reopened to date, we will have to do community centres differently than we did before. This will mean limited use of these facilities for reasons entirely related to public health. The amenities that will be available for use effective when these community centres reopen on Monday, July the 20th will include lounges, meeting and multi-purpose rooms, computer labs, washrooms, indoor pools for drop-in leisure and lane swim, and lobbies. Now this means, of course, unfortunately, that gymnasiums, fitness or active areas, including walking tracks, kitchens, saunas and whirlpools and studios will not be available for use, as many of those instances are determined by, the availability will be determined by our moving to Stage 3. We will also have changes to visitor capacity within the centres and in the pools, and visitors will be screened upon entry. These are the kinds of requirements we've seen successfully employed in our outdoor pools, and I think it's working quite well again to protect public health. The centres cannot facilitate the following activities just yet: indoor sports, fitness and wellness activities, singing and dancing, food preparation, distribution or dining, activities where equipment or supplies are passed or shared among the participants, and this would include, for example, unfortunately, cards and chess and dominoes, because I know I've been to a number of seniors' card games that they are so fond of, and I know that it's still a hole in their lives not to be able to do that, but again, it awaits the arrival of the next stage. But we are doing this, we are restricting these activities so that people can remain safe and healthy, and so that when these centres open again on Monday, July the 20th, they stay open and don't have to be closed down again. It's the right thing to do to stop the spread of this virus. An important thing to note is that some locations will have limited daytime hours because they are being used as well for the Camp TO summer camps for children. Again, the extra safety precautions we've taken in the interest of public health with regard to those camps prevent visitors and from people from mixing in with the kids who are at camp. And this is part of the public guidelines that don't allow for members of the public to be in the premises at the same time as the kids that are going to camp. So please keep this in mind if you're planning to visit the community centers. May I acknowledge in announcing this today, it's the latest in a long series of announcements of things we're reopening, with of course more to come, but that the city staff have been absolutely steadfast in all of their hard work and their respect for health guidelines as they have helped us to reopen all of these different facilities. None of this would be possible without their leadership on this. So again, I want to say thank you to the staff in Parks, Forestry and Recreation, and also to the staff at Toronto Public Health, because the two have worked hand in glove to make sure that when we do these things, we not only do them as quickly as possible, but as safely as possible. And so now, as of Monday, residents will be able to head back to those community centers knowing that it is safe to do so. On Monday, I provided an update on the success we are seeing with our Patio program. This one's a bit different in that it is done, of course, within health guidelines, but it is meant to not only provide more joy for people who want to experience a patio, especially since until we reach stage 3 indoor dining is limited, but it was also meant to extend a lifeline to a lot of people in the restaurant business who have really found it hard to struggle through the months of spring and early summer, and this will give them some extra seating so as to have them given the opportunity to make some extra revenue. The program is our way of showing support for those restaurants who are looking for ways to bring new business as quickly and safely as possible. Today's update would suggest that after the successful blitz on Sunday, that city staff have been working throughout this week to set up new locations across the city, and will be making a concerted push starting on Thursday and running into the weekend. Over 3 days, we hope to install as many Patio curb lane patio installations as possible so that restaurants can start offering outdoor dining options. So far, the city has completed 129 curb lane closures, totaling 3,394 meters of Patio patio installations in a total of 19 BIAs, business neighborhoods, across the city. This has resulted in a total of 279 restaurants being supported by these closures and sidewalk expansions through the program, and thus having extra patio space they didn't have before. This is all great news, and I look forward to reporting on the ongoing progress next week. I should mention that there are some people who applied under the 700 and some odd people who did apply for these Patio permits who will not be given a permit because they simply didn't qualify. I think that number at the present time is running at about 150, but it was guaranteed that we would move quickly to grant permits to those and make the installations necessary for those who qualified, but not for those who didn't qualify for safety or for other reasons. So again, I want to thank the staff, the city staff, for putting on these blitzes and for their hard work in having this program go from concept to reality in a very short number of weeks. The city continues to find innovative solutions to homelessness during this pandemic. We are utilizing vacant units in 4 Toronto Community Housing Corporation buildings that are ultimately slated for demolition as part of the Regent Park revitalization, and we're now using it to provide a temporary accommodation for newcomer families. The program supports the city's efforts to provide increased physical distancing in the shelter system, and it is one more example of changes we've made at lightning speed to help those who need it the most. Families and individuals will move in on a phased-in basis starting in mid-July, just around now. And by partnering with the THC and a community partner agency, we've been able to provide this accommodation in 4 buildings for up to 160 of our most vulnerable residents through to the end of 2020, while we actively work to secure permanent housing for newcomer families in need of our help. The operator, the nonprofit housing operator, Wood Green Community Services, will provide all of those temporarily living on site with additional support, including resettlement services, referral to other community supports, and assistance developing a permanent housing plan. I want to thank TCHC, I want to thank city staff, and I want to thank Wood Green and all the community partners involved who have helped to make this possible so that we can help even more of these people who are among our most vulnerable residents during the course of the pandemic. This is also one more example of the work that the city is doing on the front lines of the pandemic. And we have been clear that a lot of this kind of work for homelessness and on a variety of different things has led to unprecedented costs for municipalities here in the City of Toronto, but also right across our province and right across Canada. Earlier today, I took part in a meeting of Canada's big city mayors. And while the meeting was focused on other matters, there was strong support expressed among the mayors for my call yesterday, once again, for a national strategy to help cities across the country, the same cities in which 80% of Canadians reside. This followed direct communication I had yesterday with both the Deputy Prime Minister of Canada and with the Premier of Ontario. I reiterated to both of them the need for a national strategy, which can only be led by the national government, and the urgent need for them to reach a deal, the provinces and the national government. Canada cities, including its biggest city, Toronto, can either drive a strong recovery from this pandemic and at the end of this pandemic, or be left struggling and financially unstable, left to twist in the wind instead of putting the wind in the sails of Canada's economic recovery. The current federal government has been smart enough to invest in cities during its time in office, and before the pandemic, they were rewarded with strong economic growth. In fact, the entire country was rewarded with strong economic growth because of the investments made by the current government of Canada. That investment in cities will work again. It must be national in scope, led by the federal government, and it will pay significant dividends to that same government in terms of tax revenues and economic return, but also to Canada as a whole. I know that a deal is there to be made. I know that from my conversations with those involved in these discussions directly. As it has done in so many areas related to this pandemic, I know the federal government can lead the way in stabilizing the finances of cities across our country, which in turn will be at the forefront in a recovery which will get Canadians back to work and back to a normal life, a more normal life. On that note, I will pass the microphone over to Dr. Eileen de Villa, our Chief Medical Officer of Health, for her update for today.
Thank you, Mayor Tory, and good afternoon. Over the past 2 days, there have been 59 new COVID-19 infections in Toronto. I'm pleased to share that the increase of 14 cases reported yesterday was the smallest number of new cases in quite some time. This shows that we continue to move in the right direction. In addition, to date, 13,259 people have recovered, an increase of 111 since Monday. Turning to our COVID-19 dashboard, our status remains at yellow, with 2 of our indicator categories being yellow and the other 2 being green. Our numbers on hospitalizations and outbreaks continue to move in the right direction. I'm also pleased to share that the percentage of laboratory tests positive for COVID continues to go down. Overall, our local COVID-19 cases continue to decline, but it is a slow decline. This tells us that we need to be vigilant in our measures to make sure that we continue to see lower COVID-19 activity in our city. Data is key to our COVID-19 response, informing our actions and fighting this virus. We monitor our local data carefully and analyze what is happening in our city to understand data trends and to guide our actions now and for the future. At the very beginning of this outbreak, I committed to sharing as much information as possible directly with you. This transparency is critical to help people to understand our local data story and to stay informed on how this virus is evolving in our city. Data helps us to see who is at potential risk and how we can protect them, which is key to combating this virus. My team has been a leader in data collection, in analysis, and in information sharing. As I've shared before, it has been an incredible and very challenging journey for us as an organization. We have worked nonstop since the beginning of this year on our response, and my team's commitment is nothing short of remarkable. We have been keeping you informed through these media briefings, our daily reports, our COVID-19 monitoring dashboard, our reports on area-based data analysis, and the open data portal release that we launched last week and will be updated again today, to name just a few of our efforts. As previously noted, to allow our team more time to more deeply analyze our data to inform our response, especially for the upcoming flu and respiratory virus season, we will continue providing a comprehensive data update on Mondays, Wednesdays, and Fridays. For those who are interested in the day-to-day COVID-19 case counts, we are sharing some tracking numbers through a daily afternoon update on Twitter at TO Public Health. Work is also underway on a deeper data analysis to help us understand patterns and trends and what has changed over the course of this pandemic in our city. This is why we are working on an updated analysis of how COVID-19 has affected different populations according to factors such as race and household income. I look forward to sharing an update on this work soon. Some examples of how we use data to inform our decisions include sharing data to inform testing for people experiencing homelessness, sharing information with our health system partners to inform where mobile testing clinics would be most valuable, creating guidance documents for local businesses and community services to safely operate, given what we know about virus spread, providing public health guidance to school boards as they prepare for reopening in the fall, and informing our public health messages on how to stay safe and protect each other as the pandemic evolves. One of the questions we've been trying to answer through our data analysis is whether there are any risk factors for severe outcomes related to COVID-19. Since the beginning of the outbreak in our community, approximately 12% of cases have been hospitalized, 4% have been in intensive care units, and 3% have been intubated. We found that in Toronto, severely ill cases were more likely to be males over the age of 60 and to have pre-existing medical conditions, most prominently cardiovascular disease and diabetes. Our analysis suggests that the risk profile of those who have severe COVID-19 illness in Toronto is consistent with what is reported in Ontario and more broadly. It's important for us to understand risk factors that lead to more severe outcomes so that we can all take steps to appropriately protect ourselves and our loved ones. As our city continues to move forward with reopening, we need to continue being careful and vigilant so we can safely move into stage 3. We have all worked so hard, and we will need to stay focused to do our best to prevent increased COVID-19 activity as our city opens up more. We are fortunate in Toronto to be able to learn from the experiences of other cities and countries who are ahead of us in their outbreak as they reopen their communities and their businesses. One clear and important observation is that many places have noted increases in COVID-19 activity as more people gather in public settings. Specifically, surges in COVID-19 activity are being linked to settings like bars, where people are congregating and consuming alcohol and are less careful about following public health measures. This is happening in cities throughout Canada and around the world. If we want to keep our cases down in our city. We need to be careful, and we need to learn from these experiences and to continue following our public health and physical distancing measures. Overall, as mentioned earlier this week by Premier Ford, we remain in stage 2 in Toronto. I know we are all looking forward to moving to stage 3. However, for now, I believe that we are at the right place for our city given our current circumstances. In the meantime, we continue to prepare based on the experiences of other jurisdictions that have reopened ahead of us, so when we do move to the next stage, we know we can do so safely. Finally, I am pleased to announce that our provincial colleagues are hosting a community pop-up testing site in the Black Creek area of our city on Saturday, July the 18th. The site will be located at the Christian Centre Church at 4545 Jane Street and will be open from 10 in the morning until 2 in the afternoon. Thank you to our colleagues at Ontario Health for this important initiative. In closing, I ask once again that you help with our city to keep moving forward. We all have a role to play, and I ask at this time that we all continue to follow the 4 W's. Wash your hands, watch your distance, wear your masks, and keep working together to get our city back. I'll now hand it over to you, Brad.
Thank you, Dr. de Villa. Before we go to questions, there are several staff on the line for any answer any specific questions you may have, including Paul Raftis from Senior Services and Long-Term Care, Jeannie Romoff from Parks, Forestry and Recreation, Marianne Bedard from Shelter Support and Housing, Barbara Gray from Transportation Services, and Carlton Grant from Municipal Licensing and Standards. First question is to Mark McAllister from City News. Mark, go ahead, please.
Thank you. Mayor Tory, you've mentioned that obviously there's been a couple of blitzes to try and get patios set up as part of Cafe TO. In getting out there and observing some of these setups, it seems as though it's thin plastic separators that are being put in between customers and the traffic that's flowing by some of these spaces. Some of these spaces have concrete blocks, others don't. Can more be done to ensure the safety of the people that are using and trying to enjoy these patios?
Well, I certainly have no problem with anybody bringing to my attention installations that people don't feel meet the appropriate standard. Obviously, something that is concrete is going to provide a greater degree of safety than something that is not. And so if there are installations that people are concerned about, I would encourage them either to call my office or to call 311 and register that, and I will make sure that the Transportation Services Department, which really have done a great job at getting these set up and getting the curb lanes closed where appropriate and so on, that they go and have a second look to make sure, because we certainly want to help the bars, but more important, and the restaurants, but more important than that is to make sure we keep people safe.
Maybe I could ask Barbara Gray to get into some specifics, if you could, Barbara.
Sure.
Brad?
Go ahead.
There we go. Okay. Thanks very much for the question. So we've done a pretty thorough analysis according to the traffic control guidance in Book 7 for these setups, which is part of the reason why we have deployed the materials that we've used. They're highly reflective. We have concrete barricades at the beginning and end of each of the closures. We are looking to what other jurisdictions are using in terms of materials, and we've also been working very closely with the BIAs for those who are interested in upgrading some of their setups to include planters. So as the first phase of what we've been doing is trying to get the space set up, and so you'll start to see some improvements also to some of these setups as the weeks go on as well, in partnership with the BIAs. But certainly if you see anything that gives you a question, you should get in touch with us and know that we've done diligence to ensure that people who are going to be enjoying those patios are safe and that there's good separation between them and ongoing traffic, which is another one of the reasons why we wanted to make sure we had speeds managed in these corridors as well.
Thank you, Barbara. Follow-up, Mark?
Quickly, Mayor Tory, if you can, just speak to the fact that there's another major transformation going on with bike lanes in the city. As of today, we're seeing Danforth starting to look a little bit different, obviously as part of everything that's being done. If you could just speak to the fact that this is happening now as well.
Well, we made it very clear that we thought it was important at a time of some concern that people might have about going on the TTC, and we're trying to address that and make them feel comfortable and safe, which they are, but that we needed to have along the transit spine, especially the spine of the transit system, other alternatives for people. And I think that the bike lanes being installed along the Danforth, which will be installed from west to east, from Broadview over to Dawes Road, will present that option. We have consulted closely with the local business community. I was at some of those consultations myself, and I visited the street twice to hear some of their concerns, and I think we've addressed a lot of those, and I think this is going to be a very positive addition to the city's cycling infrastructure and to providing those transit options during the pandemic and post-pandemic period. And a note that they will be reviewed very carefully over the course of the next 12 months in every way we possibly can, including the impact on business, and that review will be brought back to the city for review.
Okay, thank you. We go next to Matt Bingley from Global TV. Matt?
Hi, good afternoon. My question is in regards to the creation on social media of fraudulent medical exemption cards for those who don't want to wear masks, and they're offering to distribute them to those who also don't want to wear them. I'm just wondering if you could both respond to what you think about that, and if Dr. de Villa, if you could clarify which precise medical conditions would actually qualify a person to not have to wear a mask indoors.
Well, may I begin by simply saying there are no such cards that are required, and you know, I can't speak to the motives of those involved in this particular scheme, but I will say that you know, just like there's a million stories in a big city, in a city of 3 million people, there are a fair number of people who engage in scams of one kind or another. These kinds of cards are not required, and I would just hope that people would be very wary of purchasing one because it is not needed, and you know, be very careful about who they're coming from. But they're not needed. I think that's the main thing to observe, and perhaps Dr. de Villa can talk about the people who are entitled to an exemption under the bylaw.
Yeah, so thanks, Mr. Mayor. And, you know, just on the notion of fraudulent activity, which is exactly what it is, as you described, Matt. I mean, I think any kind of fraudulent activity is always disappointing. But I would point out that it is generally perpetrated by a very small number of people in our city. It is a big city, as the mayor points out. But thankfully, you know, our sense is that as a city, we have banded together to fight COVID-19 together. And I would say that Torontonians, by and large, have really followed public health measures and have come together as a community to protect ourselves and each other as best we can. And we know when it comes to the issue of masks, this is perhaps one of the most community-oriented actions that each of us can take, and it's a relatively simple and inexpensive one. And I think it's really important. I can't say enough. I wear a mask to protect you. You wear your mask to protect me. How much more community-oriented can you get? And I think that's a very positive, a small measure, but still an important city-building measure that we can all engage in. When we talk about what is available, I won't go through a whole comprehensive list around what the bylaw says. Lots of details available on the website, but suffice it to say that there is no you know, proof or card that needs to be shown in and around those medical conditions that might actually prevent somebody from safely wearing a mask. We know that younger children are exempt from that, for example, and those who have a condition of any kind, a medical condition that makes it complicated to wear the mask for a variety of reasons. It may be a question of breathing or heart troubles, or it may be a question of a developmental or a cognitive issue that makes it difficult to take on and off the mask. Those are a few of the conditions. But suffice it to say that so far, what we have observed in the community is an increase in mask use, which fundamentally shows that we are, as a city, you know, really, I think, very community-oriented and interested in actually protecting each other.
Can I just add one more thing, Brad? You know, the notion that people are out selling these cards implies that there are people out there interested in buying them. And you know, I think consistent with what Dr. de Villa said, people are responding to the advice and yes, a bylaw that requires them to wear a mask, whether it's in indoor spaces or on the transit, on their own, because they understand it's making a difference. They can see that we're doing better while we still have work to do than in other places where this is not as prevalent. And so, you know, to those scam artists who want to try and sell these masks, I don't think they're going to have a big take-up on that. It's more of a political thing, and it is not honest and straightforward with people. But I just am so gratified, and I want to say thank you to the people of Toronto for the cooperation we can see with our eyes is happening with respect to the wearing of face coverings. It's really very gratifying, and it's going to help.
Thank you. And just to follow up, for Dr. de Villa, when it comes to people who are opting out for legitimate medical reasons or the reasons that you stated, how should they adapt their behavior inside a store, inside somewhere indoors to be a little bit more safe for those around them because they are not wearing a mask?
So that's an excellent question. And as it turns out, the behaviors that they can adopt in order to best protect those around them are the ones that we all should also adopt over and above mask wearing, recognizing that you're talking about people who cannot wear masks. So what can they do? Wash their hands, watch their distance, and certainly stay home when they're sick. And if there are, you know, moments where a cough or a sneeze happens to come up, cover that cough and sneeze, and then wash your hands. These are the things that actually we know make a significant difference. And if you are capable of wearing a mask, if you don't have a medical condition that precludes that, then we would advise that wearing that mask as well. So it's the 4 Ws.
Okay, thank you. We go next to Dave Ryder from the Toronto Star. Hi, Dave. Go ahead, please.
Hi there. First question is, I think, for Dr. de Villa and obviously Mayor Tory, welcome to add anything. It's really about getting playgrounds ready. That's been a big sticking point. A lot of people have questioned why playgrounds weren't open already, including some medical experts. And now that with stage 3 on the horizon, they are going to get reopened. What needs to happen and what should parents think about when they decide if they want to have their kids going back to a playground?
So I think that's an excellent question, and we know that you know, playground season and the warm weather season is fairly short-lived in our neck of the woods. So I'm sure that we'll all be glad to see playgrounds back, particularly those of us that have younger members of our family. What can parents think about? It's actually not dissimilar from what I answered in the last question. I think at the end of the day, what we're still looking for are all the good behaviors that we've been talking about, all the public health measures that best protect ourselves and those around us. That hand hygiene or hand washing where possible. I realize that's a little more complicated when you're out at a playground, but using hand wipes or alcohol-based hand sanitizer if hand washing facilities aren't readily available is probably one of the major things that can be done. Certainly avoiding going out there and playing when you know, the children are sick would be another one, and of course watching distance as much as possible. I think these are the things that you know, are important in terms of protecting health. On the plus side, playgrounds being outdoors, we know that the risk is relatively low, but it's not zero. So continued vigilance with the public health measures is the most important thing.
May I just say that when these were closed, and they're closed, by the way, under both provincial and municipal orders or directives, it was at a time way back when there was very little known about how long the virus could survive on this kind of equipment and so on. And it was also taking into account the practicality or the lack of practicality of being able to disinfect equipment like this sort of every day, many times a day after each use by different people. And so I will just say that when we're at a different stage now, obviously, of the pandemic, and appropriate cautions will be undertaken, but it still, I think, really just requires parents to exercise the difficult task of trying to keep kids from being in too close quarters with one another under the existing guidelines, and for the city to do its best to keep this equipment clean and safe. And on that note, maybe it would be appropriate for Janie Romoff to comment just on what can be done and I guess what is not practical to be done within the context of all the different playgrounds that exist around the city. Janie?
Thanks, Mr. Mayor, and hi, Dave. So our playgrounds, we have over 700 playground structures across the city, and they are inspected under a sort of national playground safety inspection program. And in anticipation of us going into stage 3, we've already started that re-inspection program to make sure that all those playgrounds are safe. And the inspection program is more of a safety inspection from the perspective of the equipment in the playground to ensure that all the hinges are secure, there's no loose parts, and when the children are actually on these climbing structures, that they're safe for them to play on. So that safety inspection program continues throughout the summer. As far as disinfecting and cleaning, playgrounds have never been, disinfected or cleaned in anticipation of kids playing on them. So the advice of Dr. de Villa and Mayor Tory around the supervision of kids on those playgrounds and the distancing and ensuring that they're playing safely and the parents that are with them is the best advice we can give. There really won't be any other rules other than the regular use of playgrounds once they're opened. We'll be out making sure those safety inspections are done, and of course taking down all the signs and anything else that may have been put in those playgrounds to stop play on them.
Thank you. My follow-up question is just for Dr. de Villa, and that's when I look at the City of Toronto COVID dashboard, there's a yellow, green, and one red that jumps out, and it's under lab testing, % of new COVID-19 tests with a turnaround time of 24 hours. It's only 37% as a 7-day moving average, and as I said, that's red. Can you tell us about that figure and why it's red and what the impact is on trying to safely recover from COVID-19?
So when it comes to the lab testing, that is something that is under provincial purview. So really understanding what is at the heart of the lab testing process and what delays may be happening there is probably a question that's better directed towards my provincial counterparts. That being said, the fact that that is a red certainly hasn't gone unnoticed by us at Toronto Public Health. So I can assure you, and I can assure the public in Toronto, that we're watching the monitoring dashboard. That's its purpose, absolutely. And we are speaking to our provincial counterparts about what the turnaround times look like, whether we're looking at the 24-hour turnaround time or the 48-hour turnaround time, which has shown significant improvement over the last week or so. So those conversations continue. I don't have a specific answer as to why challenges are being experienced at the provincial labs. I would suggest that that's a question for the province, but certainly it is something that we are pointing out to our provincial counterparts and hoping that they're continuing to work on. We have seen improvement over the last few days, so I hope that they'll continue the progress in that regard.
Okay, thank you. Final question is to Scott Lightfoot from CTV News. Scott, go ahead, please.
Thank you, Brad. It's an honor to be last. Question for Dr. de Villa. There have been a dozen international flights in the past 14 days and a handful of domestic ones landing in Toronto that have brought with them a COVID-positive case. Can you explain what's being done in terms of contact tracing now, currently, when it comes to flights? Are people still being contacted to say that they were on a flight with someone, or is it their responsibility while in quarantine to be checking the website or the app to see if their flight comes up?
So those are excellent questions. And first and foremost, let's, we know that travel is significantly down because of COVID-19. When it comes to international travelers, they are under the purview of the provincial government, the federal government. That is their bailiwick. When it comes to following up on cases, the issue is that, what's the nature of the contact and what is the nature of that which is happening on the flight? I'll have to go back to the team to find out what specifically they've done in the cases that you're talking about. I don't have the specific details, but certainly with any case investigation, the idea is to try to figure out, where were you and what is the level of contact? How much exposure was there and to whom? Is this a risk situation? And that's what determines whether we follow up with individuals. So certainly for any situation in which we recognize that there's risk, and if it's somebody who is who's a Toronto resident who, if you will, belongs to us as a case, we will follow up on them understand their circumstances, figure out who the relevant contacts are, and follow up with those contacts.
And as a follow-up, I mean, obviously people coming in from across the border, either by plane or by car, are expected to quarantine, but there have been 21,000 cases across the country where police have been called to check in on quarantine compliance. Do you have any indication as to what it's been like in Toronto specifically when it comes to quarantine compliance? If people are doing it or not, if there have been issues, and what should people do if you see or know of someone who's openly flouting the quarantine?
So I admit I have not looked at those specific statistics for some time now. I know that earlier in the course of the outbreak, I was keeping tabs on this with the team. And as you can well imagine, there are several data points that we're following. So I'd be very happy to go and look into that with the team. I know that earlier in the course of the outbreak, we weren't finding that much by way of challenges with compliance. We do receive complaints, and of course, if people do suspect that there is an issue, somebody not complying with specific quarantine or isolation requirements, we certainly do have people on the team at Toronto Public Health who are prepared to take those names and will conduct those investigations. So we do connect with our cases. We do follow up. We try to make sure that they are completely cognizant and aware of what they need to do and what the expectations are of them and why, right? Our experience has been thus far that most people are not particularly interested in transmitting their disease or sharing their disease with others. So I would say by and large, we've had good cooperation. There will always be a few people who either don't understand and mistakenly go out and violate isolation or quarantine procedures. But by and large, people do try to stick to the rules because they're not particularly interested in making others around them sick.
May I just add one word to that? And admittedly, it's anecdotal, but I have 2 or 3 friends who have come back from being outside of the country, and they report, first of all, compared to what I think was a bit of a rocky early start, they're now quite rigorously forced to fill out paperwork when they come into the country about where they're going to isolate themselves, and that they have reported receiving both phone calls and in some cases personal visits from people to follow up on compliance. And so I think compared to the rather rocky start we saw with regard to compliance with this requirement, I think there's a much better job being done now to ensure compliance, and in most cases it's not necessary because people understand that they're not anxious to spread the disease to anybody else.
Okay, thank you, Mayor. Thank you, Dr. de Villa. Thank you for joining us. Our next briefing will be next Monday, July 20th. Please check the media advisory on Monday morning to confirm the start time. Thank you, everybody. Have a safe weekend.